it may be, it's not only the machine development and not technological advancement, but I think it's in fact it's a delivery mechanism or a people's involvement in the whole healthcare system. So that's very much important. And then finally, it's a tobacco. So it's an important sector that we are considering it because of its contribution to the, in fact, the public exchequer through taxes. So it's an important thing because it's the most important sector, the single most important sector. But if we consider its health consequences, then also it's a very important thing. So both in terms of income and expenditure and the health burden, so it's the tobacco sector is very important. In this particular paper, even though it's a new idea that we need to, in fact, effectively control tobacco consumption, and the problem is that in fact tobacco is the monopoly. So we are keeping it as an only product, and we are not giving any alternative to this, or we don't have any cessation policy right now. So and because of that, the people are dependent on tobacco, which is addictive in nature. So in this particular paper, we have suggested a kind of cessation policy and also the strict regulation and in fact relaxation of the restriction towards the less harmful alternatives.
In addition, what I would like to say, that paper has also mentioned some innovative instruments and tools which we can, there are some tools we can easily instrument, which is into the very low-hanging fruit for us. And we can easily increase the tax base of Boston, right, by digitalization that, or by pulling more people into the tax center. So even there are some low-hanging fruits that we can achieve generates is out a lot more cost.
At the same time, we can also do that. The paper has kind of mentioned that we can do several community financing, right? A zakat platform, like as we are in a Muslim-based country, a lot of people we do provide zakat. So based on different sorts of community financing we can apply, which has actually successfully applied in many different other countries. Like you can take the example from Indonesia. They have that Islam-based community financing program that they kind of draw these financings and they use this. So that's another way we can have this, because whenever we talk about innovations, from the other side, if we have a policymaker, they will come and say like, okay, you have said these beautiful words, where will you get the money to implement those?